Hello everyone, welcome to my channel. Today's topic is edema from medical surgical nursing. Let's get started. First of all, there is introduction to fluid. 60% of our body weight is composed of fluid present in our body. Two-thirds of it is intracellular while one-third is extracellular. Extracellular is again divided into intravascular, interstitial, and transvascular fluid. Movement of fluid between vasculature is controlled by opposing effect of hydrostatic pressure and plasma colloid osmotic pressure. In arteries, there are hydrostatic pressure maintained, whereas in veins, there are osmotic pressure maintained. Edema is abnormal accumulation of fluid in the interstitial space located beneath the skin and in the cavities of body. Edema is a normal response of body to any inflammation or injury. This is a diagram of edema. Patient's left leg has edema, whereas a right leg is normal. We can compare here edematous and normal leg. Here is a short diagrammatic explanation about how blood and fluid exchange takes place. Artery provides oxygenated blood to organs. This blood travels throughout the organ, and then venous drainage carries out deoxygenated blood towards the heart. In between these veins, arteries, and capillaries, there is intravascular, transvascular, and interstitial space. Due to some reasons, if there is no osmosis in between the tissue or no proper movement of fluid in between the tissues, edema can occur. Etiology for edema are divided into many segments. First is increased hydrostatic pressure. Rise in hydrostatic pressure at pennular end of capillaries to a level more than plasma oncotic pressure is a cause. That results in minimal or no reabsorption of fluid, which results in edema. Next will be reduced plasma oncotic pressure. Due to reduction of protein synthesis in liver, albumin synthesis, there is a fall in plasma oncotic pressure, which leads to net movement of fluid into interstitial tissues. That results in edema. In inflammation, first of all, there is capillary endothelial injury, which increases the endothelial gap. This increased capillary permeability to plasma proteins reduces the plasma oncotic pressure and then edema occurs. Next cause of edema can be lymphatic obstruction. There is increased lymphatic drainage because of which there is fluid shift and then there is a localized lymphoedema. Sodium and water retention can be another etiology. Whenever there is sodium and water retention, one of the cause or one of the effect can be hypovolemia, because of which kidney produces a hormone called as renin. There is a renal vasoconstriction and elevated antidiuretic hormones. Aldosterone production comes after that, along with increased glomerular filtration rate and reabsorption of water. There is a renal retention of sodium and water that results in edema. Edema can be classified on various categories. First is on the basis of anatomy. There is generalized and localized edema. Generalized edema occurs in congestive heart failure, nephrotic syndrome, liver cirrhosis, and systemic infection, whereas localized edema is mainly seen in infection, trauma, and thrombosis. On basis of indentation, there is pitting edema and non-pitting edema. If we try to press the edematous surface and it returns within 2 seconds, then it is non-pitting. If you press and it does not return within 2 seconds, it is pitting edema. Pitting edema looks like this. You press an edematous surface and it will not return back within 2 seconds. Clinical features of edema can be clinical features of generalized. Generalized means edema due to some disease, systemic disease. There is hypoproteinemia, renal disease, oliguria, and liver disease. Cardiac edema means pitting edema on lower extremity and it worsens towards the end of the day. It begins from legs and extends till face and abdomen. Renal edema, edema caused due to renal disease. There are severe edema on extremities and eye. That eye is also called as baggy eye. Also there is massive proteinuria, hypoalbuminemia and hypercholesterolemia. It begins from periorbital region that is around the eye and reaches to legs and abdomen. In liver disease edema, that can be a result of liver cirrhosis, and also there is a distended vein on abdomen because there is a edema on abdomen. Distended vein can be seen. Starts from abdomen and then spreads to legs and face. In nutritional edema, protein losing enteropathy can be a cause that brings along with it starvation, hypoproteinemia, and in blood urea nitrogen test, normal level of urea nitrogen is 6 to 24 mg per dl, but that elevates in edema. Also in drug-induced edema, the drug can be nifedipine, corticosteroid, or estrogen, hormonal drug. In localized edema, it can be a result of infection, injury, and deep vein thrombosis. How can we diagnose edema? First of all, edema can be diagnosed on the basis of appearance. If localized, then there might be cellulitis, lymphangitis, venous disease. If generalized, there might be some cardiac, renal, or liver disease in the body. Onset, whether it is sudden or it is gradual, insidious, unknown. First sight of appearance. We discussed it in clinical features also. Most of the edema, most of the etiological edema starts from extremities, lower extremities especially. But there are some disease in which edema starts from either abdomen or periorbital area. So first sight of appearance is also one of the most important diagnostic tests for edema. Other symptoms that can help us to diagnose edema are constipation, which can be seen in hypothyroidism, starvation, that can be seen in nutritional deficiency edema, fever, rigor, and inflammation can be seen in nephritis, and orthopnea can be seen in cardiac edema. On physical examination, now important, on inspection, we can find a swelling of abdomen if there is edema on abdomen, ascites, fullness of flank, and umbilicus everted. Umbilicus looks like it is turned towards outside. On percussion, there is fluid thrilling and shifting of dullness. Podal sign positive. Podal sign is you keep the patient first of all in prone position. Then you ask the patient to hold the body on elbow and knee. If there is a fluid storage like this, you can find it either by palpating or percussing. Then this is a Podal sign positive. If you auscultate the lungs, crackles and wheezing sound can be heard. So there is a respiratory difficulty also. Increasing weight due to increase in fluid. Our body weight is made up of fluid. In case of edema, fluid level is increased, so there is increase in weight. Also, we can perform chest X-ray, echocardiography, 24-hour urinary protein test, and then paracentesis. Paracentesis is a process of draining out the fluid from outer layer of abdomen, that is peritoneum, by using a needle and a device. Fluid deposited at the peritoneum can be drained out. Management of edema. For generalized edema, you should treat systemic illness. Whatever disease is there existing in the body, that should be treated. For pharmacological management, we have different kind of drugs. These drugs have various kind of mechanism, like diuretics helps in increased urinary sodium excretion and increased urinary output from the body. Beta blockers relaxes the heart. Vasodilators dilates the blood vessel and helps to improve the blood flow across the cells. ACE, angiotensin converting enzyme inhibitors, brings down the elevated blood pressure if there is elevated blood pressure. Ionotropic agents, furosemide, that also lowers the elevated blood pressure. All of them have their own certain doses that should be provided within a day or 2 times a day, 3 times a day, according to the disease condition of the patient. Nursing management can be, first of all, you assess the presence of edema. You assess from where the edema starts up to where it reaches, how it continues, for how long it continues. And then should be sodium restriction in diet because there are high chances that blood pressure have been increased in edema. Patient should be encouraged to rest and 30-minutely position changing. Position changing is to promote oxygenation towards all the blood tissues, cells, and to promote blood circulation as well. Weight monitoring should be done daily to monitor how effective is the treatment till now and how is the fluid balance in the body. Auscultation of lungs should also be done so that we can check whether there is presence of hyperventilation or hypoventilation to check whether the applied treatment method has worked in the patient's body or not. Also, we can monitor patients' arterial blood gas analysis that helps us to find out pressure of oxygen and pressure of carbon dioxide in the body. So we can detect hypoxemia and hypercapnia. Thank you so much. Next note, next topic will be in next video.